Hello, this is Kelly Miners, and this is my final for NU633 Clinical Education Simulation and Technology. And I am going to do a presentation on donning personal protective equipment. The rationale behind me choosing this topic is that incorrect donning and even doffing is a common way healthcare workers become infected with disease and illness. So new students that are entering into the clinical environment, into these acute care settings, have a high risk of contracting illnesses that they would not contract if they knew the proper way of donning PPE. The learning objectives in which I have created for this lesson is to summarize steps used when donning professional protective equipment. The domain would be cognitive and the level is understanding. The next one is justifies rationale regarding proper technique when donning PPE. I think it's very important for you to understand why you're doing what you're doing and the reasons behind that. So the domain is going to be effective and the level is valuing. And the final objective is shows understanding of proper donning of PPE. The domain is cognitive and the level is applying. The NCSBN NCLEX client need category. So for the first objective, it's going to be safe and effective care environment. For the second objective, that justifies the rationale, it's going to be health promotion and maintenance. And for the final objective, showing understanding of proper donning of PPE, and that's going to be safe and effective care environment with a subcategory of safety and infection control. To add onto this, the NCSBN NCLEX client need, domain competency, and subcompetency per objective. So for the first objective of summarizing steps when donning professional protective equipment, the AN domain, I would say, would be 5, quality and safety, with the competency of 5.3, contributes to a culture of provider and work environment safety, and a subcategory of to identify actual and potential level of risk to providers within the workplace. With our second objective, the AACN domain was 9, professionalism. So I think that falls into the valuing and the justifying of why you need to learn how to do this. The competency would be 9.3, demonstrate accountability to the individual, society, and the profession. And the subcategory 9.3A, to engage in advocacy that promotes the best interests of the individual, community, and profession. And finally, the final objective shows understanding of proper donning of professional protective equipment. The domain, excuse me, the AACN domain would be 4, scholarship for nursing practice. The competency would be advance the scholarship of nursing, and the subcategory would be to demonstrate application of different levels of evidence. I am providing this lecture to students that are starting their first clinical rotation in nursing school. So these would be very new students to the nursing program, and this will be prior to their first clinical rotation and their first time stepping into the hospital. So we're going to talk about donning PPE by Kelly Miners. Why and who dons PPE? So anyone that is taking direct care of patients that are or may be infected should have some sort of PPE on them. High rates of virus transmission are transmitted from the patients to healthcare workers, so you need to protect yourself in order to be safe in the workplace environment. And also, so you can keep your other patients safe so you don't spread infection from one patient to the next. Personal protective equipment is an article used to prevent the wearer from coming in contact with hazardous, infectious, chemical, radiological, electrical, and physical agents. So that's the definition of what PPE is and what we use. Some examples are shoe covers, face shields, gloves, goggles, gowns, head covers, face masks, and respirators. And we're going to talk about these different kinds of PPE. We need to know the steps on how to place the PPE. And once you remember the steps and do them in correct order, because order is very important to put them on safely, then this will help protect you and your patient. So first, you're going to identify and gather the proper PPE. So what kind of isolation is your patient in? What kind of PPE is required? Many hospitals have references and sites where you can look this up. Next, you're going to perform hand hygiene. So you're going to make sure that you're starting with a clean environment on your body. So you're going to clean your hands before you put anything else on. Then you're going to put on the isolation gown. Then you're going to put on the N95 or PAPR, depending on what's recommended, or mask. And we're going to now place goggles on after the mask. Then finally the gloves. And once all of that is on properly, you can enter your patient's room. So let's look at this step by step. We're going to look at putting the gown on. So like I said, sequence is very important. So the type of PPE will vary based on what kind of isolation it is. So we're going to talk about kind of the most extreme isolation. That's going to be with our COVID patients. So you're going into a COVID patient room. This is how you're going to want to do this. You're going to put the gown on, make sure it fully covers your torso from the neck to the knees and arms to the wrists and wraps around the back. Fasten it in the back if it's that kind, or you fasten it on the side depending on what the gown is. Next is what you're going to put on the mask or respirator. So the mask or respirator, there's different kinds of masks, there's different kind of face shields, and there's different kind of respirators. So we want to make sure that we secure the tie or elastic bands at the middle of the head and the neck. Make sure you fix and push down if there's anything on the nose, you don't want space in there. You want this mask to fit snug on your face and below the chin. And you want to make sure that you've been fit tested for if it's an N95 or that you know how to use the PAPR. We're going to look at the difference between the two. So the N95 is on the left. It's a mask that must be refitted for. So if you have changed in your weight, had facial hair, things like that, you're going to have to be refitted for. And every year you should be refitted for. It sometimes can be harder to breathe and can cause kind of heat and moisture built up in it. A PAPR is used, it's a battery operated machine with a HEPA filter that you can put on. Generally at some hospitals, I know across the city, that if you have not been fitted for N95 or do not pass the fit test, then they can use a PAPR. A lot of times hospitals do not have as many PAPRs as they do the masks. So we've identified our proper equipment, we washed our hands, we've put on our gown, and now we've put on our mask. The next thing we're going to do is goggles or a face shield, depending on what you're going to put on. Now, if you have the PAPR on, that's going to be a little bit different, but if you have the mask on, this is what you would do, and that's what most of you are going to be using. So place it over your face and eyes and adjust it to fit. So make sure it's fitting properly and securely. Then finally, the last step is your gloves. You're going to extend the gloves and put it to cover the wrist of the isolation gown. So you see how it's going over the gown. It's not going under the gown. So it's covering and extending into that area. And I have included a video for you to watch, and I will send it to you if you need to watch somebody actually put it on before you get to the clinical rotation. And I do highly recommend that you look at that over and watch the video on how on someone placing this PPE on. So let's talk about our donning steps again. The first step, as we said, was to what? Gather your equipment. Then you want to wash your hands and make sure that they're washed well, and you're starting with a clean environment. You're going to find the proper gown and make sure it fits properly. It covers the torso, covers all the arms. You're going to put that on and tie it where it needs to be tied. Then you're going to take your mask or your PAPR. You're going to put that on. Put that on properly. Then you're going to put your face shield on or goggles. And finally, you're going to put your gloves on. They extend up over the gown, not under the gown. And if you want to put shoe covers on, you can do that. And it's safe to enter the room. So my plan would be to present this presentation prior to clinicals, ask the students to watch the video prior to clinicals. And this is how I would measure my learning objectives with this clinical education. So again, my clinical objectives are to summarize steps used when donning professional protective equipment. And to measure this objective in the clinical setting, I would have the students state the proper steps of donning PPE prior to having to do that. So I would meet with them prior and have them go through all the steps and state the steps. To measure the objective of justifies rationale regarding proper technique when donning professional protective equipment, I would have them measure this objective in post-clinical setting by asking students why donning PPE correctly is important and why it should be valued in practice. And then finally, the final objective was shows understanding of proper donning of professional protective equipment. I would measure this objective during the clinical setting when students show the instructor how to don PPE correctly. And I would make sure each one of them would have that opportunity in the clinical setting to show me how to do that. Here are my references. I had quite a few of them. Thank you for watching my presentation, and I look forward to watching yours.